Back. The good news is that AIDS can be ended by the year 2030. That's according to the latest UN AIDS report. The bad news is that HIV infections among women and girls in sub-Saharan Africa continue to hamper progress in reaching the Sustainable Development Goals. For more on the report's findings, I'm joined by UN AIDS East and Southern Africa Director Githuku-Shongwe. Thank you so much for joining us this evening. And the report we're talking about is a report entitled The Path That Ends AIDS. It contains data and case studies which highlight that ending AIDS is a political and a financial choice. It also shows this path, clear path, that ends AIDS. So if the path exists, does it mean that the political and financial will are lacking?
Yes, good evening. Thank you so much for that. We are saying that we have seen countries that have been able to advance significantly in their response to HIV. Botswana in our region, Eswatini, Rwanda, Tanzania, Zimbabwe. These are countries who've achieved our treatment and testing viral suppression targets. A country like Botswana has been able to invest significantly enough that we're able to see a very clear path to the elimination of mother-to-child transmission. So this is a country that has made great progress. And what we are saying in this report is that there are 4 key things that need to happen in order for countries to truly turn the corner on ending AIDS. And yes, the political and financial choice is at the forefront of this. So the first thing is that we have the data, we have the science and the evidence. We know what needs to get done. We know who are the most vulnerable, who we need to target. It's the girls and the young women. It's the children who are living with HIV, it's men who are not adhering to drugs, We know the second thing is that we need to tackle inequalities. Gender inequality persists. We have to deal with those issues of gender violence, human rights challenges for people living with HIV and men who have sex with men and female sex workers. These are very vulnerable to HIV. We have to tackle the inequalities that impede progress there. The communities themselves, the communities of people living with HIV and other civil society organizations, when they are engaged, when mothers mentor other mothers to make sure that they can deal with the transmission of HIV to children, it transforms the pathway for them. And then we want to ensure sufficient funding. So we have countries like Botswana, South Africa, Namibia, who are funding over 70% of the AIDS response. But then we have countries like Madagascar, which is one of those countries that's lagging significantly, that barely funds 1%. All of it is external. So we're working hard to invite countries to really continue to push politically to ensure that they have the financial investments and that we invest in the areas where there's the highest vulnerabilities. Prevention, prevention, prevention is the largest word that we have to continue on this path.
It's interesting that you say Botswana, Eswatini, Rwanda, the United Republic of Tanzania, Zimbabwe, they've all achieved those 95, 95, 95 goals in terms of treatment, identification. Yeah. Why is South Africa not on that list?
As you know, South Africa is the highest burden of HIV in the world. So it is a large number of people, and South Africa has done exceptionally well. But we still have a large number of people that we're having to deal with as South Africa. So here is a country that is about 8 million people living with HIV. Of those, 5.5 million are on treatment, but there's still about 2 million just a bit over 2 million who are not on treatment yet. And those have to be identified, brought in for testing, given the treatment that is necessary. Some of them are children. It's a big indictment on us that where you have, close to 80% of people living with HIV who are on treatment, we have close to 60% of children who are not on treatment, who are on treatment and there's a gap. So it's identifying those particular communities, but also at a granular level, we know where, province by province, where there are gaps. So if you look at any country, urban centers, so people who are in Gauteng are being reached. But when you look at other provinces, the reach is not the same. Men are lagging. They're very poor at adherence. And so, also trying to reach communities that are very vulnerable, female sex workers, for instance. This is a criminal act in this country still. We have not been successful yet in decriminalization. What that means is that women who are engaged in this in sex work are not easy to reach. They're not easy to bring for treatment when you have these kinds of barriers. So this is what we mean when we say that inequalities drive new infections, and inequalities are barriers. So we have to identify what some of these barriers are. People who inject drugs, this is a community that when you think about them, you almost sort of dismiss it because this is just bad behavior. But the truth is that these are many young people, many young men in particular, who are engaged in injecting drugs. And we have programs of harm reduction in most of our countries, but they're really a hard group to reach. So the big issue is the vulnerable that need to be reached so that they get onto treatment, from children to men and all these different groups that I've mentioned. South Africa has done exceptionally well, but it is a very, very, very high burden. And so it requires, much more granular level attention to make sure that we can turn it around.
Let's talk quickly about funding. Funding for HIV declined in 2022 from both international and domestic sources, falling back to the same levels as in 2023. Do the coronavirus pandemic and global economic decline have anything to do with that? And how do we get back on track?
I mean, that's exactly the point. I think you're really spot on in that, for many countries, COVID, countries had to make decisions based on the resource pocket that they had. And they made decisions that this was an emergency, this was urgent, and so they turned attention away from some of the resources that went into the HIV program. South Africa, to its credit, actually maintained a lot of its HIV funding and even upped it in some instances. And so that's been a big issue. But, there's a general turnaround of financing in the global economy. But the issue of political will, because we have done so well, so we're a bit sort of the victims of our own success. So because we've done so well in achieving these targets, it then looks like there isn't a need, as desperate a need, to put in the finances that are required to reach the end of AIDS. But as I was sharing with you, we still have huge inequalities and huge barriers that we have to overcome. And so what we are doing is saying that this pathway needs us to revisit and reignite and re-energize political will. And we need the leadership where they are. The multi-sectoral leadership of AIDS has to push to the end. We're just 7 years away. It's not that far. We just need to stay the course and not pull back. This is the largest pandemic that we've had. We've had success. It's over 40 years. We have to stay the course. It's easy to switch off and say we've got treatment, we're sorted. We're not. We still have, we know what to do, but we still have some dangerous areas where we have to pay attention.
Thank you so much for your insights. We really do appreciate it. That was Githuku-Shongwe, Regional Director of UNAIDS.